Delhi has woken up to yet another morning covered in smog and for the sixth consecutive day falling in the severe category. Delhi has also woken up to reporting at least 7,700 and more cases being reported of COVID-19 in just one day. Now, both these figures are related. This is what multiple studies, doctors and now even IMA saying that 13% spike in COVID cases is directly related to air pollution. If you look at these figures at the moment, it's not just Delhi. In fact, the entire NCR region. In Gurgaon, the AQI is 496, severe. In Faridabad, the AQI is 485, again severe. But look at that figure on your screen, the chart which talks about the top 10 polluted cities. Delhi is not even in the top 10 polluted cities. There are other cities from Uttar Pradesh and Haryana which are taking up all those spaces. These cities much more polluted than the capital at the moment. In fact, the Delhi Health Minister, who's a COVID survivor himself, has talked about how this is the third wave and the worst so far.
थर्ड वेव है, थर्ड वेव का पीक चल रहा है. अब 2-3 दिन 4 दिन में कम हो जाना है.
सर, इज द थर्ड वेव द वर्स्ट वेव सो फार?
जो तो लग ही रहा है कि जून में जो नंबर्स थे सितंबर में उससे ज्यादा थे और जो नवंबर में उससे ज्यादा.
Alright, let's get a live update now, and Akshay Dongre joins us and he's bringing us updates from Gurgaon, again in the NCR region. Akshay, what is it looking like at the moment? Wow, look at that haze behind you. That is a thick cover of smog, and it's been like that for almost a week now, is it?
Well, exactly, yes, Sonal. First of all, a very, very good morning to you and to all of our viewers. But when we are talking about the air pollution, the news is not very good. You can see from the visuals behind me, it is looking like all of these cars that are coming, all of these vehicles are coming out of a thick layer of smoke. And if I just turn around, I can show you that they are again disappearing into the same kind of thick layer of smog. I would like to show you the sun here. Behind me, the sun is also looking very, very dim at this point in time, and this is all because of the smog that has covered the entire region of the NCR. When we are talking about the CPCB data, the data of Haryana government and the UP government, the category of air quality is in severe category, health hazard. This is in fact a health hazard, Sonal, because the people, elderly, in fact general public has been advised to not go out until and unless necessary. But as we can see, all of these cars flying on the road, they definitely are going to their offices, to their workplaces, and they don't have any other option but to go out in this poisonous air. And the reason that I am out here in this poisonous air is because the people should realize that what exactly is the situation right now. The government should realize that what the people are forced to live in, the situation when we are talking about, are really, really dangerous for any normal person. Earlier we have seen that a lot of knee-jerk reactions have been taken by the Delhi government and by the government of other neighboring states as well. But the pollution remains in very, very severe category. So the situation is really, really bad, and the people must realize that until and unless absolutely necessary, they should not be out venturing in these hazardous conditions, Sonal.
That's right. In fact, Gurgaon is the 5th most polluted city at the moment in the country. Delhi, like I said, does not even feature in the top 5. But it's not like it's any better. We have Sukirti now joining us from right outside India Gate, which is covered in a thick layer of smog we see as well. Sukirti, Delhi not in the top 10, but the worrying the figure at the moment is the fact, this direct correlation that doctors and scientists now repeatedly are establishing between the bad air quality and the rise in coronavirus cases.
Well, yes, Sonal. First, we'll just give our viewers a sense of what the India Gate looks like, and then we'll come to the COVID connection as well. This is the situation of the India Gate right now, as my camera person is showing you, covered in a layer of haze. Otherwise, anybody who lives in Delhi could tell you that when they pass from this road, the India Gate is very clearly visible. And if my camera person can pan to the other side and show you that we are standing on Rajpath right now, and from this point the Rashtrapati Bhavan building is usually very clearly seen. Even though it's at a distance, it can be clearly seen on other usual days. But now, because of this layer of smog that is beginning to cover all of this entire Delhi right now. The Rashtrapati Bhavan completely covered in haze and cannot be seen. Definitely the COVID connection at this point of time proving very lethal for Delhiites. Doctors have been saying that the air pollution, the PM 2.5 particles make one more susceptible to COVID. And yesterday Delhi recorded 7,745 cases, which is nearly the 8,000 mark that Delhi has approached. And this is Delhi's highest daily spike. Report by the National Center for Disease Control last month had said that Delhi would see up to 15,000 daily cases in winter. And we are nearly the halfway mark at this point of time. And the rest half is the journey that none of us want to travel. Nobody wants that Delhi should be reaching that prediction of 15,000 daily COVID cases. But at this point of time, things looking very grim for Delhi.
So, Kirti, can you give a quick update on what happened to that new law that the government had said that they'll come out with? They, in fact, went up to Supreme Court and said that, well, don't come out with guidelines, that the government will come out with an ordinance on their own. What's the status on that?
Well, the members of the committee were selected and announced by the government recently. Mr. M.M. Kutti, who's been the petroleum secretary in the past, he was announced as the chairperson of this commission. So all of that Air Quality Commission, those announcements have been made, declarations earlier made in court, as you said, that the central government claimed that we don't need other laws because this Air Quality Commission will be formed. But so far we've only heard on the formation of this committee. The committee is yet to hold even its first meeting. So only when they hold their meetings, they make these laws, then we will see the implementation. But nothing looks like it would change for this particular winter for Delhiites. Another year of suffering ahead. Does not look like their decisions are going to make impact anytime soon, because their meetings, then the paperwork, all of that may take a long time for things to change on ground.
All right, so Kirti and Akshay, thank you so much for bringing us those live reports. Grim reality at the moment. Let's take it forward with our guests this morning. We've got Vimlendu Jha, we've got Sanjay Mehta, and also Parimal joining us at this point. Vimlendu, we've been speaking about this year after year, and I just fail to understand what is it that we are not doing right. At the end of 5 years, we are nowhere better. We are in fact much worse when the entire conversation about air pollution started. I mean, smog was a word not known to people just 5 years ago. And for 5 years, we've been headlining it, we've been talking about it. There are petitions in court. The government says that they will do something. But look at the pictures around you. We've not, this time, the air pollution is much worse. It has come earlier and it is more deadly.
So, Sukriti, it's not about what did we not do right. The reality is that we didn't do anything in the last 5 years to really combat this situation. This situation is the making of our government because of their inaction and completely ignoring this health crisis. And it's not just an ecological crisis, as we all have finally acknowledged this year because of COVID, because of the studies that are actually staring at our face, that, you know, environmental issues are not just a smog or a bad vision problem. It's actually a health problem. It's a health emergency. And the government was completely aware of this right now. Last several years, we've seen those studies by Lancet, by several other medical research and public health organizations, the impact of bad air on public health. 1.5 million people die. But there's nothing, as in your question, you asked, where's that commission? Imagine, it's not a, you know, I've always been critical about this, that is it a new commission that will actually solve the problem? No, it is the execution of existing laws or any law that you actually formulate, unless and until the executive, which is the government, which is be it the central government or respective state governments, until and unless they actually start working on the ground, until and unless they motivate and really get the lower executive to do their task, things will not change. Some things will have to fundamentally shift. Imagine Delhi's AQI being in 500, 600 today, but there's construction activities happening everywhere. We still have coal thermal power plants operating in the immediate Delhi's periphery. As you said, Agra is the most polluted, city in the country right now. And yes, as Delhi gets its share and all the focus mostly. So it is a pan-India crisis, and it is a bigger crisis than any other thing that we're talking about, both in terms of mortality as well as morbidity. And our governments have completely failed, and they don't even take this seriously, unfortunately. We have not seen any long-term
But I don't
plan.
understand why. Dr. Sanjay Mehta, the politicians are breathing in the same air. Their kids are breathing in the same air. Why is it not on the top priority of the government?
I think it's simply because nobody seems to be falling dead, on the street. So that's the reason why everybody, there is a kind of a huge apathy towards pollution, right from the public to the government officials to the politicians. It has never, people have never chosen the government with these issues in their mind, So probably that's the reason, the politicians are also not reacting to this.
Right. Can I bring in Parimal Bardhan at this point? You're somebody who's been a former advisor to the European Union as well. What would your advice at the moment be to the government? And again, I just want to underline this. This is not a Delhi problem. This is a North India issue at this point. What is it that immediately needs to be done and can be done that is being ignored?
You've said very rightly, we are sort of grappling with this problem in a very naive way, unfortunately. Your reporters have very aptly, described the situations prevailing in NCR and particularly in Gurgaon. I live in Gurgaon. We haven't seen days, there's sort of clear sky or even the sun. We can't look at it. We can't see it. It's so sad and so unfortunate. And despite the fact that we have all the information available with us, like for instance, last year it was reported 1.67 million people died due to air pollution.
But what can be done?
The fact remains, as one of the speakers said, we have a plethora of laws, plethora of commissions, and institutions, starting from the laws of course, the SDM rules, Air Pollution Control Rules Act, and so on and so forth. And we had EPCA. Now we have a commission. Last year we had this, what you call National Clean Air Program. All these are fine. There's a words on the ground. We don't see their actual, implementation of it.
And unlike COVID, this is a very visible problem. You look at the haze, you can feel it, you can smell the smoke. And even then, I don't understand why this is not going through. I just want to bring in Dr. Sanjay Mehta again on this. Dr. Mehta, it looks like at the moment that it's up to the citizens to protect themselves at the moment, right? Apart from wearing N95 masks, which should now, I believe, be a must in Delhi, not a cloth mask which people were wearing so far to protect themselves from COVID. That switch has to happen immediately. What else can people sitting at home or stepping outside, forced to step outside, do at this point?
I think we all have to raise these issues that, small little fires around us, we have to keep reporting to these people. Though I know what is happening is that their response is absolutely tepid on this. They keep blaming that the citizens are the ones who are burning these small little fires and that we can't do anything about it. I'm really aghast that what are the pollution control boards officials are supposed to be doing, It's like we are around 20,000 citizens in Gurgaon. For last 5 years, we have been, going from pillar to post to all these local ministers, MLAs, to the secretaries, and we have given all the suggestions to them that what needs to be done at the ground. There is dust lying on the roadside. Please make
and
the
what's their
pavements
response?
over there. CND dust is CND can be recycled to enforce the payments. The garbage can be segregated by the citizens. The citizens are totally aware of it. When they segregate, the municipalities, they have these vendors who come and they mix them up, again. And then ultimately it gets burnt off by their vendors and themselves, They themselves are burning this, rather than carrying it and, recycling it or, encouraging the citizens to do the composting of 50% of the garbage. These are small little issues which has been formulated in laws. There has been an act in the parliament, SWM 2016, a beautiful act, If we go by the letter and spirit of that, there are some districts, I think 1 or 2 districts in the whole of the country, which have actually adopted the SWM 2016. The others haven't even bothered. They have just outsourced to a vendor without even putting this a clause into their act, into their whatever contract they have, that you have to follow this act.
Vimlendu, I get the outrage. I'm feeling it myself, trust me. But what is to be done at the moment? And I want to take the same question to you. What is it that can be done by citizens and then the government?
I don't think that order needs to change, because, it's not, the onus is not on the citizens. It has to be the government first and the citizens, because I feel completely outraged when, you put the onus of environmental management onto citizens. Citizens are responsible, but this making is not of the citizens. As in, you and I can't buy DTC buses and improve the public transport infrastructure. You and I cannot really, shut down the coal thermal power plants. You and I cannot go around fixing the pavements that we're talking about. You and I cannot just go and, go to the landfill and stop the fire. These tasks are of the government, and therefore citizens have two responsibilities, if I have to really talk about citizens first. Citizens need to put pressure on the government and make this an electoral issue. That the governments are responsible custodian of our air and our health, and they need to do their needful. That's one. And of course, citizens need to change their lifestyle and do their bit to really, of course, not pollute much and to protect themselves from this entire apathy or this bad condition that we're talking about. That's one. Two is, for government right now, although I'm not a proponent of emergency measures, but we are in emergency and we will have to take those emergency measures. I don't understand why there's been nothing that's been said by our respective governments, in at least Delhi government, about construction activities that is going on. Construction activities will have to stop. I think this is the time right now to really look at, or even if you have to, again, as in that these changes are only 1% to 2% change in terms of overall impact. We will have to think big, because, Delhi is running out of air. As in, it's become a joke that it's 500, 600, 700, and it's going to get worse. And you don't even, you only see these, one-line tweets from our chief minister and from our environment minister. Nothing from the central government, and
there seems to be a lack of a plan. I think there seems to be a lack of a plan to actually address this issue, and this lack has been there for the past 5 years. I don't know what they're waiting for. I'm sorry, gentlemen, I have to leave it there for the moment. I have to slip into a break. But this is a story we'll keep a very, very close tap on right here on NDTV.